This segment is sponsored by VCU Health.
The doctor is in, and you have questions. Millions of Virginians have been vaccinated against COVID-19, but medical experts are hoping many more will choose to be vaccinated as new variants are spreading abroad and here in the United States. Dr. Gonzalo Bearman, Division Chair of Infectious Diseases at VCU Health, is here to tell us more about COVID-19 and vaccinations. Thank you, Doctor, for joining us.
Thank you.
All right, so, with 150 million Americans vaccinated, those who are choosing to wait, what would you say to them at this point?
Well, I recognize your fears, but I would also like to say that there are hundreds of millions of people who have been vaccinated, as you mentioned, that the side effects are generally very mild for the vast majority of those individuals. And the risk of not being vaccinated, particularly for those who have chronic underlying conditions or advanced age, are far greater than getting COVID.
All right, so you mentioned side effects. How common are the side effects from the COVID-19 vaccination?
Well, many people don't have any side effects, but the most common side effect will be certainly pain, some tenderness at the injection site, typically the arm. Others will experience fevers or chills or almost a flu-like illness for 24 to 48 hours. And those are the common side effects with COVID vaccine.
Yeah, I had a sore arm with mine. That was about it. So when should someone seek medical care if they're having problems?
Well, certainly if the problems go beyond 24 to 48 hours into 72 hours and are associated with increasing pain, fever, then they should seek medical attention, contact a provider, or go to an urgent care center.
All right, so we've got this large group of Americans who have the vaccine, but also we've got a bunch that have not. So when should someone seek medical care for a side effect? And then we'll talk a little bit more about the vaccine.
Sure. Again, for a side effect, if the side effects are lasting longer than 24 to 48 or up to 72 hours, and they continue to escalate or worsen in severity, then one should seek medical attention. But generally, side effects are mild and are usually gone within 1 to 2 days.
All right, doctor, let's talk these variants. We're hearing some pretty strong stories about them. Are they affecting Virginians at this point?
Well, fortunately, the variants are small and few across the Commonwealth of Virginia, but there is a concern that variants from other countries, such as Brazil or a Delta variant, could take a foothold in parts or much of the United States and increase the transmission of SARS-CoV-2 or COVID-19, and could potentially be more virulent or cause more severe disease.
Who needs to be vaccinated?
That's right. So it's important for individuals to be vaccinated. This shot or this vaccine really matters. By being vaccinated, that decreases the risk of not only infection, but also transmitting it to others, and the risk of these variants really taking a foothold within the region.
A lot of us are trying to get back to normal. Is the pandemic behind us at this point?
I think that for many of us, the pandemic is in the rearview mirror, but not for all of us. So there is a lot of COVID-19 transmission activity in other countries with new variants at play, and there's always a risk that those variants could come to the United States and set back the progress that we've made thus far. It's not entirely over.
All right, thank you, doctor. For more information, visit vcuhealth.org. There's more Virginia This Morning coming up next.